exercise is also considered a stressor for the brain as well as for the body. But unlike circumstantial stressors, regular exercise causes the HPA axis to become more sensitive to even low cortisol levels, and it causes the feedback loop to shut off production of the glucocorticoid in a very effective manner so you're not overexposed to this. This is the Transformational Life Consulting Podcast with Deepa Grandin, MD, where Christians like you get the practical support and tools you need to build your spiritual, mental, and physical well-being, and to guide you on your journey to health and wholeness based on evidence-based science and God's Word. I am your host, Dr. Deepa Grandin. The title for today's podcast is Exercise for Mental Wellness, a Different Ballgame. A commonly used definition for exercise is planned, systematic, and repetitive physical activity that enhances athletic performance by improving body composition, fitness, and motor abilities. And wait a minute. I don't see anywhere where it says anything about improving your mind. Well, I'm going to be sharing information with you that will hopefully convince you of how important exercise is, not only for the physical body, but also for the mental and emotional well-being. So studies in the field of mental health have shown that both short and long-term physical exercise have multiple benefits to the functioning of the brain. To start this important topic, let us start with the effects of stress, right? Who doesn't face stress? It's an expected part of life. Exercise has been shown to alleviate the negative emotional state caused by stress, and it serves as a protective mechanism against the negative impact stress can have on health. So one of the major pathways through which exercise impacts mental health is through the hypothalamic pituitary adrenal axis, also known as HPA. Right, try saying that 5 times quickly. The primary role of the HPA axis is to produce a hormone called glucocorticoid. This hormone mobilizes energy and distributes it to multiple organ systems to ensure energy availability, even in the absence of stress. So one way the glucocorticoids release energy is by breaking down stored sugar and fats in the liver. And when you exercise, the glucocorticoid release is greater and it breaks down sugar and fats a lot more efficiently, so you can see how it plays a role in good physical health. But coming back to the mental health, the HPA axis is also the central stress response system in the body. So when an individual is exposed to acute stress, so say you're stuck in traffic or you're getting into an argument with your spouse or coworker, the brain releases a substance called corticotropin releasing hormone, or CRH, which comes from the part of your brain called your hypothalamus. Now, this CRH hormone stimulates another part of your brain, which is called your anterior pituitary gland, to release another hormone called adrenocorticotropic hormone, or ACTH. Now, the ACTH has to travel to the gut area where your adrenal glands are to access your adrenal cortex. And this is how it promotes the glucocorticoid production. It can take anywhere from 15 to 30 minutes. Now, once the individual is out of the stressful circumstance, there is a feedback loop that shuts off the glucocorticoid production because exposure to glucocorticoid is also not good for the body. But sudden stresses, such as doing a math problem, learning a new sport, can actually benefit the brain because it creates something called brain plasticity. That is basically the ability of your brain to enhance how well it functions, as well as cope with circumstances and situations and regulate your emotions. So I've basically given you a very simplified description of stress response at its base level. but there are so many variables that govern how one individual versus another responds to stress. To give you a most simple example, women are most susceptible to the effects of stress due to the modulatory role of sex steroids, particularly estradiol. It activates the neuroendocrine response in a very different way. And that's the reason why, especially women in their reproductive age, are twice as likely than men to develop stress related mental problems such as depression or post traumatic stress disorder. Now, let's talk a little bit about chronic stress. So, chronic stress is different because it's over a long period of time, such as you're overworked, you're dealing with financial hardships, death of a loved one, marriage, divorce. There is prolonged production of glucocorticoids. And like I told you before, prolonged exposure to glucocorticoids is not always the best. And on top of that, when these individuals are exposed to new stress or a higher level of stress, there's more glucocorticoid production. And then the feedback loop to shut off the glucocorticoid production is delayed. So what that means is chronic stress causes changes within your HPA axis. And the chronic stress also creates an imbalance in your nervous system, especially your autonomic nervous system. So your autonomic nervous system is basically that part of your nervous system that regulates involuntary processes like your heart rate, your blood pressure, respiration, digestion. That's why you will find that people with chronic stress have high blood pressure, they're prone for diabetes, and they age really fast because the stress causes changes at a cellular level where it increases substances like cytokines, reactive oxygen species. And so that's why it's always said that stress is the worst factor when it comes to aging rapidly. Now, exercise is also considered a stressor for the brain as well as for the body. But unlike circumstantial stressors, regular exercise causes the HPA axis to become more sensitive to even low cortisol levels, and it causes the feedback loop to shut off production of the glucocorticoid in a very effective manner so you're not overexposed to this, causing the HPA axis to fully recover. So, especially when you've done an exercise protocol, at the end of it, your HPA axis has recovered way more efficiently than if you were just exposed to chronic stress on a day-to-day basis. And so this is the reason why people who do exercise regularly are able to build something known as stress resilience, which means that your body can cope with long-term stress a lot better than somebody who does not exercise on a regular basis, because you're teaching your HPA axis how to shut off the glucocorticoid in a much more effective manner. Additionally, the higher oxygen demand in the brain while you exercise leads to an increase in growth factors. So they are, I'm going to throw out some names like vascular, endothelial, and brain-derived neurotrophic growth factors. Now, just to remember that growth factors, they promote blood flow to the brain as well as neuroplasticity. So again, it's the same thing as brain plasticity, which is your lifelong capacity for the brain to rewire and change based on responses to learning and experience. So this is a very important role that exercise plays in improving your brain health. The growth factors also increase stress resilience, like I had previously mentioned, and it decreases mental health disorders by enhancing communication within the nervous system. Finally, exercise is associated with optimizing levels of essential emotion and behavior regulating neurotransmitters. What are neurotransmitters? Glad you asked. Neurotransmitters are chemical messengers that your body cannot function without. Their job is to carry chemical signals, also known as messages, from one nerve cell to the target cell, which in this case is in your brain. And examples of neurotransmitters are serotonin, dopamine, gamma aminobutyric acid, also called GABA. Now, let's move on to the psychological aspect. Exercise is associated with a higher level of self-efficacy, which is basically defined as one's belief in their ability to succeed in a particular situation. A critical precursor for high self-efficacy is mastery experiences, which includes overcoming challenges, which is what exercise does, right? So when an individual successfully completes a difficult workout or achieves an exercise goal or masters a sports skill, their brain learns to be less threatened and more confident that the individual can cope with other challenges that they face in life. So, just like the adaptive HPA axis response I previously explained to you, increased self efficacy from exercise can translate to better coping skills when faced with life's challenges. Now, besides reducing stress and increasing the production of feel good neurotransmitters in the brain, another amazing thing about the benefit of exercise is it improves sleep. And now we all know how important sleep is in regulating our emotions and our cognitive brain function. So, cognitive brain function is simply your ability to pay attention, to remember, and language processing. So, one of the mechanisms by which this is achieved is exercise increases melatonin production. Melatonin is known to assist in not only falling asleep quicker, but staying asleep longer. Melatonin is instrumental in improving sleep quality as well as quantity. So, a study that was published out of New Delhi, India, showed that 12 weeks of fitness training in college students improved sleep quality. Polysomnography studies, which is basically a way of measuring brain waves while an individual is sleeping, showed that regular exercise lowered non-REM stage of sleep, which is your very light stage of sleep. And it increased your REM sleep, which is more the deep healing stage of sleep. And both moderate and strenuous exercise have been shown to increase these properties of sleep quality. So, this is especially proven to be helpful in individuals with mental health problems. Oscar Lederman from the University of New South Wales, Sydney, Australia, published a paper in the Journal of Psychiatric Research showing that exercise has statistically significant effects on sleep quality in adults with mental health problems. Now, these individuals, prior to incorporating exercise, they struggled with falling asleep and staying asleep. Having improved sleep in turn also helped overcome symptoms of mental disorders such as depression, anxiety, psychosis. Now, I've spoken a lot about sleep and about how exercise helps the efficacy of the brain. Now, specifically looking at individuals who struggle with mental disorders, there are more and more publications looking at using exercise as a way of treating different mental disorders. A systematic review published in the British Journal of Sports Medicine by Ben Singh from the University of South Australia looked at the effectiveness of physical activity as an intervention for improving depression and anxiety. And what they found was that physical activity was highly beneficial, both in the general population, because we know not everybody has a diagnosis of depression and anxiety, but they can still struggle with controlling emotions, but also the individuals who were diagnosed with depression and anxiety that needed medication, that physical activity was an added benefit in helping them regulate their emotions. Another paper published by Tilburg University in the Netherlands compared antidepressants to running therapy and showed that while running therapy was just as effective as antidepressants from a mental health perspective, running was far superior to the physical benefits since long-term use of antidepressants such as selective serotonin reuptake inhibitor, also known as SSRIs, and tricyclic antidepressants or TCAs have been associated with diabetes and weight gain, especially when used long-term. So again, I want to touch upon a few other benefits before I conclude this podcast. There are other benefits of exercise from a brain neurohormonal perspective. For instance, it creates a healthy balance between ghrelin and leptin. A Spanish review paper published from the University of Murcia in Spain showed that exercise decreases ghrelin. Now, ghrelin is the hormone that is responsible for making you feel hungry. And on the flip side, exercise increased concentration of leptin, and leptin does the opposite. It makes you feel full. This helped individuals not overeat or indulge in mindless snacking, which we all know is a common cause for obesity. Another important factor in the brain, known as the brain-derived neurotrophic factor, BDNF, is also increased when individuals exercise. Now, BDNF is found to have a protective effect where it reduces amyloid beta toxicity. This has been linked to Alzheimer's disease progression. A paper that came from Karolinska Institute in Sweden, published in the Nature Journal, showed that during exercise, the brain is thought to be one of the primary tissues that produce and release BDNF into the bloodstream via the blood-brain barrier. So, in conclusion, a new definition for exercise that I would propose is exercise is planned, systematic, and repetitive physical activity that enhances mental and physical performance by improving brain and body composition, fitness, mental, and motor abilities. So while we have repeatedly been told about the importance of exercise for physical well-being, the benefits of exercise on the brain provides a whole host of valuable gains that should not be taken lightly. So whether you or your loved one suffers from mental disorders or sleep disorders, or you're just looking for ways to age better with a healthy brain, do not neglect to incorporate exercise into your lifestyle routine. According to the current physical activity guidelines for adults, incorporate 150 minutes of moderate intensity physical activities along with 2 days of muscle strengthening activity a week, and this should be a good goal to shoot for. I hope the evidence I shared would motivate you to get started and stay in the groove.